Hello and welcome to the Common Weal Policy Podcast. I'm Craig DL, I'm the Head of Policy and Research at Common Weal. And this week, my guest is Nick Kemp, the convener of the Common Weal Care Reform Working Group. Hello, Nick. How are you?
Hello. I'm good, thank you.
Care is something that almost all of us will need at some point in our lives, or we'll be caring for someone who needs it, or we'll know someone who does. It is a sector that is vital to the well-being of the nation. And since the COVID pandemic, there have been growing calls for Scotland to launch a national care service, somewhat analogous to what the NHS does for health. Common Weal has been part of that call, and we have recently published our blueprint of what a national care service should look like if it is to be worthy of that name, coming off the back of 18 months of research and development from Common Weal's Care Reform Group. So I'm very, very pleased to have the convener of the group, Nick, here to talk about those plans and what they might mean for Scotland if they are adopted. So, Nick, just to start us off, how did you become involved with Common Weal, and how did this lead to the formation of the Care Reform Group?
Well, the short answer is that after I'd worked in social work, and particularly to do with commissioning of care homes, that at the beginning of the COVID crisis, I sort of, like everyone, was sitting around thinking about what's going to happen as a result of this. And then actually Nicola Sturgeon made a speech in which she said that actually while the government would focus on sorting out the NHS, she expected the care home sector to manage the pandemic themselves. And knowing the care home sector very well, I just thought, this is an absolute disaster waiting to happen. This is just a terrible decision. So what happened then is basically I came out of retirement. I knew from social work, which I put aside for environmental campaigning, and I had some contacts with a Common Weal through Source, Ben Ray there. I'd written some things about land reform, actually. So I sent him thoughts on an article about what was happening, and he said, this needs to be more than an article. Sent it over to the policy people at Common Weal. That's you and Robin. I think it went to Robin first. Robin immediately said, could you write a report on this? So at the end of May, we produced a publication called The Predictable Crisis, which was all about why COVID had hit the care home sector so severely. Anyway, after that, what happened was that I was involved in writing things for Common Weal for a few months. It turned out that there were some other people around at the time who were also doing care work. And what happened is we brought those people together, as well as I was talking at various public meetings and so on. So we asked for people to be interested in getting involved. And out of that, we established the Care Reform Group.
I remember vividly that time. It always kind of surprises me, even though it shouldn't, that when we put out calls for this, for groups of experts to come together, the wealth of knowledge that sort of pops out of Scotland that way. And also kind of sometimes how those people come out and they're suddenly surprised that other people are interested in what they've been complaining about for years.
Yes, well, I think that's the case. And I mean, one of the amazing things about the group is, I mean, I didn't know anyone on the group, right? And I ended up as convener completely by accident, really. Someone needed to take it on. So I said, look, because I felt very strongly about what was going on in the care homes. I still do, and what all of that. And I thought, well, actually, I'll have a go. But what's been brilliant about the whole process is these people who I'd never met before, right? All come with their different areas of experience, had different views, and we've come together and through discussion, we've tried to come up with something that we could all agree with, and that has been an absolutely fantastic experience for me. And I've learned so much from it, so that's been fantastic.
Now, I made that comparison between the National Care Service and the National Health Service. We've had the National Health Service now for decades, the best part of a century going on. but care has been kind of left behind on that political agenda. And it's only with the pandemic that it has sort of appeared. Why has it taken COVID to bring the National Care Service onto the political agenda?
Yes, well, there's a long history, and part of that is that back in 1948 there wasn't really enough money for care, so that was left with local authorities to do what they could, and care sat with local authorities for a long time. And there's been never really a coherent policy attempt to create a national care service until actually the turn of this century. And the idea first emerged actually from as part of the of New Labour, and they came up with some ideas of a national care service, which weren't very good, but they were totally then transformed, interestingly, by Jeremy Corbyn's leadership there down south. We saw very little of that in Scotland. I wasn't involved in that at all. I don't even know the people who developed the proposals, but actually they were very, very strong. So there had been some policy background, if you like, going on that hadn't been picked up by anyone else. But then I think when COVID struck, I mean, just the disaster of so many, I mean, everything that happened was so disastrous that people, we had, people who were infected being discharged from into care homes from hospital. We had older people abandoned in their houses with no services. We had adults abandoned. We had children who were on the child protection register who weren't being seen any longer. So all aspects of the care system just, it was plainly very close to collapse. And what that did was raise the idea of care in popular consciousness in Scotland. And obviously from that, then there have been certain politicians pushed the idea of a national care service, and that prompted the Scottish government to respond. And
can you give us an overview of what that response from the government has looked like so far?
Right. Well, there's been 3 phases. And the first phase is they set up a review of adult social care under Derek Feely, who'd been a previous head of health at the Scottish government, and had then gone to America and worked in the private sector on improving health in the private sector. And I think that's very significant because basically the emphasis of the recommendations of the Feely review were about how do we improve care, more top-down management. So the proposal that came out of that was that we need a centrally run national care service. And the second stage of that was then the Scottish government consulting on those proposals. So that happened at the end of last year. The consultation responses have now been published. And that was, I would say, well, you can read both our response to the Feely review and to the National Care Service consultation on the Common Weal website. Our responses are there. But basically, it wasn't, there were lots and lots of questions which really didn't tackle any of the fundamental issues. And then the third phase of this is what we've been seeing and it's come to light in the last couple of months, and we've played a role in exposing that, has been the Scottish government putting out sources to the private sector to try and design the National Care Service, which is quite extraordinary that government, so we've got a large contract with KPMG, another one's about to be let for data services in the NHS. So that's the 3 phases. What I think I would comment on all of it, though, is that what's in common behind it is that there is no attempt at radical reform. What the proposals do is try and maintain the current system, and fundamental to that, there is not so far been any attempt to define what care is about, what should a care service really do. So actually, if you try and look at any of the consultation on what's going on at the moment about actually who is it that needs care, what type of care services should we be providing, there's almost a complete gap. And of course, that comes down to resource constraints. A lot of it comes down to resource constraints. And if you assume that you've only got the current resources, you're really stuck with trying to make the current system work better. And that probably comes back to how I got involved in Common Weal, because actually what I'd done is, like many people, I got into social work. I suppose I wanted to help people, but there's a bit of me, the idealistic part of me, also wanted a better society. And I'd ended up in management and been trying to do ever more with ever less for 20 years. And that approach is just completely, it's dead. It's not going anywhere. But the really disappointing thing about this is that the Scottish government is still, I mean, we just called it, it's flogging a dead horse. And they actually need to have a total rethink of how the system, what sort of care system we need.
Yeah, that was something that's kind of struck me in some of the conversations we've been having at our weekly meetings, is that sometimes the response from government has been very, as you say, very focused on the resource constraints. What can we do with the money we have? And there seems to be a bit of a philosophical gap on what is care, what it should be. And we had a recent podcast with another member from the group, Mark Smith, who has written a paper on that philosophical approach to care. I'll make sure there's a link to that in the description. But it does strike me that you really have to go back to that level of fundamental approach to then be able to build something that you can call a national care service.
Yes, we think so, absolutely. And I suppose the important thing to say about care is it's integral to all our lives. So none of us would develop as children and so on without, you need some sort of parenting, right, and some sort of care to develop into an adult. But the other side of it is that actually care can go wrong. So we know that awful things happen in childhood. There's there's a neglect, there's a lack of care, but there can also be abuse and so on, and that really affects people in their lives. So one of the key things about care is actually it's a very, very complex area. And it's all around what's fundamental to care is about relationships. And, relationships are the most important thing about human life, I guess, is, in terms of our friends, family, connections, people we see in the street, how we get on. It's what makes life important. But it's also things that can go really badly wrong in our lives. And we need to put that at the heart of a care system. Now, what's happened is the government keeps talking about things like a rights approach. But when you're talking about a carer looking after a relative, right, and you talk about something like a right for respite, we end up with a thing about, well, actually, both people in that relationship have rights. So how are you going to reconcile those differences? And that's a very difficult job, and actually that was the job that social workers were trained to do. What I was trained to do is to work with families, and you would try and support people to try and resolve difficulties in relationships. We've lost all of that from the care system, and instead in fact when people talk about rights now, it's become reduced to consumer rights, where actually what they're talking about is that actually people should have the right to buy the services they want. Right? And that poses a whole lot of other problems for the system. And so and that, of course, has been part of Scottish government policy since the Scottish Parliament was created. There's been a drive to press what's now called self-directed support, where people use money to control their services and to give people power. And we think most of that is very, very problematic.
Yeah, I mean, that right to respite particularly it's important to we'll get into this a bit later in the show, but it's important to recognise the reality of that right as it's not a right if you can't enact it. If you as a carer have the right to respite but no ability to take that respite, then your rights are being breached and there's nothing you can do. But similarly, the person you're caring for has a right to be cared for by someone that they have a trusting relationship with. and it could be difficult to give a carer a period of respite and still be able to deliver that level of care.
And part of that, it comes into the how good are our services, because one of the problems at the moment is what's absolutely essential to care is time. And to have a relationships take time. And what we've got is a care system where we've got too few staff rushing around, and they have time to do personal care tasks for people, right? Everything's got reduced to a sort of a Fordist production line. We'll do this task and then that task and that task. And there's actually, what's important to people is the human contact, the ability to have a dialogue and so on. And we talk about rights of people using services, but actually, if it's almost impossible, if you're receiving a service from a home help and they've only got 15 minutes to see you, how can you negotiate what you want? There's just no time to do all of that. So actually, we need the resource, giving staff the time, empowering them to take decisions, right? All of that, and it requires more resources, is absolutely essential to get care right.
Now, obviously, the Scottish Government's proposals aren't complete yet, so we can't say too much about what their vision of a national care service will be definitively. But based on the proposals we've seen so far and the general trajectory of how it's being developed, what do you think that version of a national care service could end up looking like? And would it actually really reform the care sector?
I think we don't know at the moment what's going to happen, and that's because actually, in terms of response to the government's proposals, people who are incredibly important and powerful in the current system are now expressing serious doubts about them. So the local authorities have basically been outraged because the proposal is to remove care from local authorities and give it to new joint boards, which is basically under the aegis of the National Health Service. The health boards have got concerns actually about that too, and I think partly because the resource issues haven't been addressed, but also they've got enough problems on their plate without having to take on care too, so there are problems there. We've got particular interest groups like GPs expressing major concerns about being moved out of the NHS into a national care service that sits separately. So we've got a whole lot of interest groups, right, within care who are expressing major concerns. What we don't know is how the Scottish Government is going to react to that, or how it's going to resolve the issues. And that's, in a sense, where I think our vision in Caring for All, right, comes in, because we have got a solution to that. We have got solutions to that. And the most important part of which is to say, actually, we should stop trying to integrate care and health. Care is very different to health in many ways. They do different things. Health is ultimately about your body and treatment, whereas care is more about your human networks, relationships with other people, who's there to help you. So they do rather different things, and trying to force those two systems together, it hasn't worked. And actually, what we should be trying to do is, if we had a separately funded national care service, what we need is basically to fund both health and care separately and properly, instead of trying to force the two, if you like, two different services into one budget, which is what's being proposed at the moment.
Especially as something like health, as important as it is, has a real tendency to absorb any money that goes to it. So there'd be a real competition between the NHS and the care service over that one budget, rather than the two sectors complementing each other.
Well, exactly. And there's always within the NHS, and there's a massive crisis in the NHS at the moment, because the big hospitals always take the money. In terms of policy terms, delayed discharge from hospital has been the driver behind social care for the last 20 years. You know, the main thing that politicians have seen the care system should do is to get people out of hospital beds, right? It's not to look after people in the community. It's been driven by hospital. So the hospital agenda drives lots of things. And we've got a crisis in GP services at the moment because they're just completely overrun. And one of the reasons they're overrun is actually because social services have come close to collapse. When people have no one else to go and see, they go and see their GP because they're the last people around. And actually, that's not the best way of dealing things. So we're talking about actually if there was a separate care service in local communities that people could go to for support, that would relieve a lot of pressure on the NHS.
Yeah, so let's give folk a bit of a flavour of our vision for the care service. We obviously don't have time to go through the entire Caring for All paper. It is huge, it is detailed, but I must encourage people to read it if you've any interest in care at all. We think it's a worthy addition to the debate. But Nick, yeah, give us an overview of the guiding principles of our National Care Service and what it would look like.
Right. Well, the first thing is we think it should be cradle to the grave, or we sometimes use the term womb to tomb. It's different, but people will know what we mean. It should be there for people whenever they need it through their lives. And we do, where we do agree with the Scottish Government is in their consultation, as they did propose bringing all of care together, right, under these joint boards. And I think bringing care together is the right thing to do. People don't have different needs just because they're technically a child at one moment and an adult the next. And we need to have integrated care services that follow people through all their lives. So that's the first thing. The second thing is it needs to be accessible, right? So people, and the problem at the moment is we've got eligibility criteria, we've got barriers. It's almost impossible to get to see a social worker. You've got to do something really wrong if you want to get, and the social worker will then come and see you rather than you going to see the social worker. That isn't the right place that we need to be. We need to have places where people can come into a place and they can get advice, support on whatever they need when they need it. So we need local community-based officers and so on that are very accessible to people. The third thing is and I've hinted at this already, we absolutely need to invest in care staff. And I mean, everybody knows that care staff are really badly paid. And pay is part of that, what we need to do, but actually we need to fix some of the other things too. It's a complete scandal at the moment. You can go in to a job working with someone, say, who has dementia and challenging behaviour, and you've had absolutely no training to do that at all, right? And we need to have proper training programs where people have training before they go into work, and then when they're in work, and because care work is often very challenging because you're dealing with people, a lot of people who receive care services lack mental capacity in one way or another. So there's people with dementia, there's people who've have got brain damage and so on, and all of those people have very complex issues. It requires a lot of knowledge and skills and sympathy, right, with people to be able to work with them effectively. That has to be developed, right? And people, care staff, can have, they will walk into situations that are very difficult. They'll have complaints lodged against them, all sorts of things. That's all very, very stressful. So we need to have support systems as well as training for care staff so that people can actually go and get support from their colleagues and so on. All of that has gone at the moment. So staffing's the third thing. The fourth thing is we don't think we will get staffing right while we have a for-profit care system. One of the big problems at the moment is if the government tries to increase wages for staff in the care sector, because so much care is now outsourced, There's basically nothing to prevent the business owners taking a large cut of that, right? So actually, the way to fix the staffing issues and so on is to make sure that all care services are not for profit. And it would have the added benefit is that we are wasting large amounts of money at the moment on paying phenomenal salaries to people in the city and so on to make money out of care. Most people instinctively know that, like a care service like the NHS, it should be not for profit. And so I think those are probably, and the fifth thing I would just say about it, besides supporting staff, is we need, and I've hinted at this before, we need to empower staff to take decisions. And that's both social workers and care staff. And what happens at the moment is all those staff are bound by really complicated procedures. There's a procedure for everything, right? And huge amounts of legislation, and it's practically impossible for anyone to know what they're supposed to do. What we're suggesting is actually we need to make care simple again, right? We need to have people need to have been trained and so on, but they then need to be able to make professional judgments with their people who they're working with about what's best. And I'll just give a practical example of this. You can, we've heard of cases, for example, of someone will go along and they've been asked, a home care member of staff, to ensure somebody eats because they're underweight or whatever. They're seen as being risk because they've lost weight. So they go into the house and the person that day says they don't want to eat, right? They'd like to go for a walk. But actually what happens under the current system is the member of care staff isn't allowed to take them for a walk, right? Even though actually if they got out for a walk, maybe they'd come back afterwards, right, and want to eat, right? The member of care staff has absolutely no discretion about what they do with the person. They're just caught up in these procedures, which are all supposedly about governing risk. It doesn't work, and we need to empower staff to be able to take decisions on a day-to-day basis instead of being forced to spend a fixed time in somebody's house. We need to be able to allow them that if somebody needs a bit more help one day, they'll stay at one house a bit longer. If someone needs a bit less, they'll spend a bit less there, and so on. And our current systems just don't allow any of that. So what we're suggesting is we actually need to put power back to staff.
Yeah, and that then feeds back into the whole relationship side and that trust that you build up between the carer and the client. What you mentioned there about food, it reminded me of an anecdote that my mum, who is a care-at-home carer, has told me about how important food can be for people who are receiving care. That some people, for example, need some assistance with eating, and for some people that can be quite an empowering act. You know, that they are, with a little bit of help, they are able to eat well again. But for another person, that can be quite a disempowering act, that something as fundamental as feeding themselves unaided is no longer something they can do. And a carer needs to be sensitive to the client's needs and wants in that regard, to ensure that they get the care that they need in a way that doesn't disempower them.
Absolutely. And because we're all different, what works and is good for one person isn't going to be for another. Yeah. And it's, as a result, it's the idea of reducing how we provide care to a set series of rules, right, which are imposed from on top by management, right, on people, just doesn't work. And we talk about it, I suppose, and there is a whole school of thought now, which is around about we need to have what's called ethical decision-making in care. So actually staff on the front line need to be able to take complicated decisions about what's right and wrong in a particular situation. And they need to be allowed to try things, and they need to be allowed to make mistakes and not get hammered for that. But at the moment, if anyone makes a mistake, the first thing that happens is an investigation, and actually that is extremely traumatic for people. And I was talking to a social worker actually just this week who used to be in a team I worked in, and was just saying that she'd had to investigate someone there'd been a complaint by someone using a service against this member of staff who'd only just started working. She was completely mortified. Of course, she hadn't done things, but the person she'd been working with, I mean, because of the situation, so what they did is they made complaints. They had a whole history of that, and you've got to be very tough. You've got to be trained. You've got to be support. You've got to get through those sort of things. You need a lot of support, and so we need to empower staff and train them to work in these very difficult situations.
So let's say we get our way, politics all works out in our favour, and the Scottish Government adopts our plan in full. One of the questions that will almost inevitably come up is, how much will a national care service cost, and where would Scotland get the money?
And I can't give an answer, but that's not really surprising, because at the moment the Scottish Government doesn't even appear to know what it is spending on care, and has outsourced some of the research on that to KPMG, although why they would know is anyone's guess. Our data on care is really a disgrace. It's not very good, right? But actually, more as important as that, we have no data on unmet need. Now, what used to happen when I started in social work in Strathclyde is, whenever you couldn't meet somebody's needs, if you were a social worker going in and you thought there was something that wasn't a service that could help, or you couldn't find a solution for them, you had to record that unmet need. That's 30 years ago. All of that stopped. Audit Scotland, actually, in a report just a couple of weeks ago on social care, said we need the data on unmet need in Scotland is terrible. That was really welcome that they've highlighted that. But if you don't know how much need is, and you don't know what you're spending at the moment, there's absolutely no way that you can come up with a figure for what a national care service is going to cost. But I think I'll make 2 points about this. And so what we've done in Caring for All is we've just focused on what we could do at the moment. And actually, what the increase in national insurance contributions to pay for care in the UK, right? It wasn't the right way to raise money. It's in an equitable tax, but the money is there. And the money that should come to Scotland from next year is about £1.1 billion. That's a lot of money compared to what's spent at the moment. We think probably local authorities might spend 2.8 billion, right? Setting aside COVID factors and so on. So it's a lot of extra money coming into care. We could do an awful lot with it. So, for example, we could start basically taking over the whole of the private sector, and that would save more money to invest in care. We could start setting up proper training for the workforce. We could give some of the pay rise that's being demanded by the unions, not all of it. The point is, with that 1.1 billion, and it might be more, I think the top estimate is it might be 1.45 billion. That is enough to make a start. So what we need to do is we need to make a start, and then we can worry about, after we've made that start, right, what else, what then happens. But what I would also say about this is the current systems are very inefficient. So what we have is we've got lots and lots of bureaucracy, lots of rules, a lot of time is spent administering things. And actually, if we reform the care in the way we're proposing, we would make a whole lot of savings, and we would make better use of resources.
And yeah, I do just want to stress that from Common Weal's perspective, the national insurance rise and then its transition into the health and social care levy that is coming in from Westminster we don't think it's the right way to do it, and it's obviously using a reserved tax rather than devolved powers. And as the name suggests, the health and social care levy, we've seen reporting that actually most of that money is going to get piled into health in England and leave almost nothing for social care. So there's a danger, as we were saying earlier, of the confusion of the two budgets, leading to money that could be going to care being taken up by health instead.
Yes. And I think, I mean, that's in a sense, we're making the bid now, and we recognise that the NHS is under massive funding pressure. But actually, we've got an opportunity. Let's use it to get a proper national care service off the ground. The money, you know, it's not the best way to raise it. There's lots of issues about it, but actually Scotland has got an opportunity, and we should grab it.
Yeah. So again, trying to just give a flavour of what the National Care Service could mean. We've given the overview of it, but it's also good to try and work out what it could mean for an individual within the system, within the sector. So I would like to explore a couple of hypothetical case studies. So what would the care service mean for someone who is currently living in a care home, someone who is a care at home carer, and what it could mean for someone who is what we called an informal carer, someone who is looking after a family member or similar, but who isn't employed to do so.
Okay, and there's a slightly different answers depending on whether, well, or very different answers depending on whether you want to take the Scottish Government's vision of a national care service or our own. Right?
Yes, let's compare the two.
Well, okay, but I will start with ours, right? Because I think this is so for someone living in the care home, the first thing is that care home fees have gone up for people who are paying for their care, for self-funders, has gone up way above inflation, right, for the last 10, 15 years. And it's part of a money-making business, and the money often ends up in tax havens, right? And it's a complete financial racket. And there are people in care homes who are paying £1,500 a week for care, and probably what those care home owners are spending on the staff and everything is nearer 800 or 900, right? And that's it. So they are making huge profits. And we need to basically stop people being ripped off. The Scottish Government has recognised part of that in that they've said that they want to increase free personal care levels to cover care home fees at the moment. But the problem is that isn't accompanied by any control on care home fees. So what's going to happen is exactly what happened when free personal and nursing care was introduced. All that did was, as soon as we started paying for self-funders, the private providers hiked their fees, right? So unless you control care home fees, just increasing free personal and nursing care won't solve anything. So that's one thing for people in care homes. The second thing, our proposal where there's no parallel from the Scottish Government, is we would like to see all services basically having a committee that basically has real power to run it, that is made up of people using that service. So care home residents, that's obviously limited because a lot of residents of care homes have dementia and how far they can participate is limited. But we would also like that to involve staff, so the staff, frontline staff working in the care home, and relatives, informal carers. And to just give one example of this, people will know that at the moment there are still ongoing issues of relatives of people in care homes being allowed to see them, right? And this is run now for 2 years. There have been problems about people seeing their relatives in care homes, and all this top-down management guidance and everything else has not resolved the issues. We actually think that the best way to deal with it is take it away from the managers, right? Give power to people at the front line who are most affected by care to take decisions how to organise these things. the care relatives have had lots of very sensible issues about, I mean, they don't want to take COVID into care homes and kill, you know, because they're relatives, they care about it. They've had a whole lot of very sensible solutions. And I think that if they had sat down with staff, they could have been done a lot better, right? And come up with some things that are a lot better than what's come from on high. So that's, and we would like to see that model across all services so that people have real power. And obviously needs to be discussion how that's done. So the second thing in terms of, and we covered a bit about the people working, care workers, and I mean, under our proposals, I mean, basically it's better pay, right? So that the people are suitably rewarded for the job, training and ongoing support. And I think it would make a real difference. The Scottish Government is still in their proposals. I mean, they've increased pay to £10 and 2 pence an hour, I think it is. I mean, it's just shocking compared to what, I mean, people know you get paid far more in a supermarket, right? Nothing wrong. I'm not complaining about supermarket pay, but care workers deserve a lot more. There are still no proposals for any training for staff. They're talking about induction of care staff, but there is no training proposals for care staff. We absolutely need a proper training program, and support. Well, that's just off the agenda. You know, it's as though the Scottish Government thinks that care staff are just people who, well, you tell them to do something and they'll do it. Right? There's the idea that care staff are human beings, right? The idea that we need a staff voice as well as the voice of people with care experience. The government's talked a lot about care experience, but not about staff experience. We really need to put that on the agenda.
Does the Scottish Government plan mention anything about collective bargaining for care workers?
No, so I've forgotten the exact form of words, but there is some loose words about negotiation. And there is very little recognition of actually that we need far stronger unions in care workplaces.
Now, on to the third group that I mentioned, informal carers, people who they're not professionally employed but are performing care out of love. What is in it for them for a national care service?
In terms of what the Scottish Government is offering at the moment is a very complicated right to respite, which as said, we don't think will work, right? But it is a limited right. There's all sorts of, the consultation had all sorts of qualifications, eligibility criteria they've consulted on whether people had to be doing so much care to get this respite and so on and so forth. We've got a totally different approach. We think that if we start, and we need to recognize that at the moment that, and we call them informal carers, so it's unpaid carers, right, provide the vast bulk of care in Scotland. Our guess is perhaps 85% of all care is provided informally rather than through formal care provision. So without those people doing that, care would collapse. What's more, research has shown that a large percent of them are doing over 50 hours a week. You know, it's phenomenal. So they're working longer than most people do in paid work, caring for people. And we think actually that the simplest solution to this is, and it's absolutely right, that people should be able to care for people if they want, but actually people shouldn't have to be providing care for relatives if they don't want to do it, right? And so the answer to that, the answer really to supporting informal carers is to ensure that where people have unmet needs, if you assume a carer stops caring, that person's got unmet needs. If they have a right to a service, right, the informal carer can then do what they want. So the important thing is actually that we have sufficient care services to look after people where that care is wanted, right? And what's happened at the moment is, because there are so few services, we have informal carers being dragged in to look after people, and their mental health suffering, they end up, their income suffers, there's a whole lot of other consequences. So, we see the answer to informal carers is about actually extending care provision and removing eligibility criteria for services, so that, and what that would mean is, if a carer decides to go on holiday, the person they're looking after, well, if they need help, they just qualify for help automatically, right? There isn't any, oh, well, you've got to wait for this, you've got to wait for that. We just do it. So I think that's we've got a very, very different approach to the government on that. What we would also say, though, is that the situation of informal carers the moment is we also have to deal with issues that are wider than a national care service. So, and key parts of that is income, because people give up work to look after people. The carers allowance is not very much. I think we had someone corrected the figure we'd quoted in the report this week. We got it slightly wrong, but I think to my memory it's about £65.
£67 a week. It's an absolute pittance, and when you're saying it's when you're talking about providing care for 50 odd hours, you're talking well below the equivalent of minimum wage for absolutely vital work. Yeah,
130 an hour basically. So and but we also need to deal with things like housing, because obviously, and as people get older and so on, that actually, well, what happens is relatives and people will go and stay with elderly parents for a while, or they'll want to do that. Well, some people can do that if they live in decent accommodation. Other people, right, if people have just got no spare bedrooms in their house or their parents' house, they just can't do that. So we have to sort out some of the other infrastructure things that makes it possible for carers to care for people. And I think that's really, really important. And that probably leads on to, one of the ideas or one of our proposals in Caring for All is that we should create a public care service, rather like public health, and that basically the job of public care was to raise awareness and to change policy elsewhere, to do all the things, right, that we need, other things that we need to change in society to make good care possible.
And I just want to stress the importance of this particular side of things, that the care service is there to support informal carers who have in many cases been abandoned and left to it by successive policy. And it's to support people when they want to provide more care, or they need some assistance in filling those unmet needs. It's something we're sensitive to, because almost all of us have done it or know someone that has. Many of the Common Weal staff have provided this kind of care.
Well, and actually, the other thing I should say that is really very, very important, and we talked before about how care is so complicated, right? And relationships are complicated, and part of it, you may feel family ties or a duty, you feel you should do things, and caring is very tough. So, and it's tough whether you're an informal carer, you're a relative, or whether you're a paid member of staff. But just as we need to support paid members of staff, we need to support carers. Now, there's been some work done about that around carers centres, but actually they're relatively few and far between. And on what we're envisaging in terms of community hubs and so on is just that someone needing direct care themselves can walk off in walking off the street and get support. So people who are involved in informal caring should also just be able to go in, get support, and those hubs would also be the location for support groups and all the other things that those carers need.
Now, thank you for coming on to the show, Nick. Now, I just have one final question. Now that the big project of this National Care Service is complete and out there after 18 months, what's next for the Care Reform Group? Because you have had a discussion about this.
Yes, we can't say at the moment. We haven't agreed totally. We have got a couple of other projects. We've Caring for All. Well, it's quite a long document in some ways. In other ways, it's very short. Care is very complicated, and there are a whole lot of issues that you could cover in more detail. So there are some things where we're likely to do more detailed papers. And one of them might be about what reforms were necessary if a national care service was to be delivered through local authorities. So we'd like to do something on that maybe before the elections, get something out to enable informed debate at the local authority elections. So that's one thing. But we're also, we had considerable discussion on a whole lot of particular issues, right? Because actually there are certain ideas and ideologies that dominate care at the moment. So, for example, trauma is the key word that is flung around for everything, and it's used to explain everything. We're quite skeptical about some of those things. We think they need to be challenged. We need to think about a different approach sometimes to how we do care. So we're also thinking of some more papers that are probably aimed at people who are working in care as well as the more general public. As far as the group goes too, it's been a fantastic group of people to work with. Although we only just met each other quite recently, it's been all online for 2 years, but it's been that's been fantastic. But I also think the current time, we've thrived on having different viewpoints. I could probably personally say we've probably all become a bit too comfortable with each other. We've reached our consensus, and actually it would be pretty good if we could get some other people involved in the group and also wider in Common Weal. And obviously there's a whole lot of initiatives going on to do that at the moment.
So if you are in the care sector, any aspect of it, and you please read our work, and if you think you have something that you can add, then please get in touch, and we'll put you in touch with the working group and see how you can contribute to that. And of course, it does go without saying that Common Weal will continue engaging at the government level with the proposals as they go through the political process. We will be lobbying politicians. We will be campaigning in public. So I'm just going to end the podcast now by finishing, as I always do, by reminding folk that Common Weal as an organisation, we are entirely reliant on donations from the general public to support our policy development and our campaigning work. We don't get government money, we don't have corporate sponsors, we don't even have adverts on our website. So if you have valued the policy work that folk like Nick have been putting out, and you value the campaigning we're doing to try and make those policies a reality, then we deeply appreciate anything you can give us to support it and make that happen. So thank you for coming on to the show, Nick. It's been a pleasure talking to you.
And to you, Craig. Thank you. And I should probably point out at the end that none of the members of the Care Reform Group get paid. It's all entirely voluntary.
As indeed, and we very, very appreciate that voluntary contribution.
It's a pleasure. It's a fantastic thing to be involved with. Thank you.
So thank you again for this week's policy podcast. Please listen to it. Please share it. Please, if you know anyone in the care sector who you think needs to hear this, please give it to them. And please come back and listen to the podcast next week.